This seminar is for educational purposes only. It is not a substitute for professional medical advice or treatment. Consult with your medical provider for medical advice or treatment. Although the presenters try to keep the information in this seminar as accurate and timely as possible, the speakers and Mather Hospital assume no duty to ensure the seminar is error-free. The speakers and Mather Hospital are not responsible or liable for any claim, loss, or damage resulting from you viewing this seminar.
Good afternoon, everybody, and thank you for joining us for our HealthyU webinar series. Today's topic is urgent care versus ED, knowing where to go. At any time during the presentation, please feel free to enter any questions you may have using the Q&A feature at the bottom of your screen. We will answer as many questions as we can within the time allotted, and your questions will always remain anonymous. And today's presenter is Dr. Adam Wass. Let me bring up your PowerPoint here, and then we can get started.
All right, thank you, Jonathan. So today's talk is titled, When Do I Need to Go to the ER? Subtitle, What is Not Appropriate for Urgent Care? So I'll, by way of introduction, I'm Adam Wass. I have been the chair of emergency medicine at Mather since 2014. I've been associated with the hospital since 2009. I love Mather. I live in Port Jefferson. It is my go-to place for myself, for my family members. And I guess the origin of this talk came several years ago. It was actually during COVID. And there was a desire at that time to sort of get an understanding of, at least for the public, what certain conditions are appropriate for an urgent care visit and which ones should really just go directly to the emergency department. My colleagues and I have a fun time each day in the ED, talking about patients who get referred from urgent care. And sometimes we'll just roll our eyes and we'll say, my gosh, why didn't they just come straight here? With some of the things that people go to urgent care for. And we'll get into some of those things, but I understand that urgent care is convenient, and we'll talk about some of the advantages and disadvantages. And the whole reason for this talk is, if you have a condition, what are some things you should consider urgent care for, and when should you consider going to the ER? So we'll get started. We'll get rolling. If you can go to the next slide, please. So here's our agenda. So what's appropriate for urgent care as far as injury and as far as illness. And then we'll kind of go head to toe, and we'll talk about some common ailments, when you should go to urgent care, when you should go to the ER, and when to call 911 when it might be a really serious emergency. And then we can do a little update on COVID. A lot has changed since then, since 2021, I think was when I first gave this talk. And we can do some Q&A at the end, and I'd be happy to answer questions. Next slide, please. All right. So urgent care, why do people go? It's convenient, it's great for people who have insurance. Their business model is you will not wait long, right? So short wait times, that's kind of how they sell themselves. And urgent care really kind of fills a need, I could talk for a long time about primary care and what all the issues are there in the United States. But obviously urgent care would not have developed and become such a successful business model if we had a successful primary care model. And so for people who don't, have a primary care doctor, aren't affiliated with a primary care doctor, a lot of people use urgent care as their primary care. And that's fine if you're, relatively healthy and you have just, a bunch of urgent, you're just going for urgent issues. But no, I could talk for a long time about urgent care versus primary care, but today we're talk about urgent care versus emergency care. So when you go to an urgent care, you're going to be probably seen by a physician assistant or a nurse practitioner in most cases. They do have physicians working at urgent cares, but oftentimes those physicians are supervising several what we call advanced practice providers or advanced care providers. So you may have one physician who is in charge of 3 or 4 urgent cares in a region, and they may physically be at one site, but just kind of overseeing virtually at the other sites. So oftentimes you're going to end up seeing a physician assistant or a nurse practitioner, and they're really designed to treat acute minor medical illnesses and injuries, and they do a very good job at that. Next slide. So what can they treat at urgent care? So simple lacerations, right? So if you get a cut, it's going to need maybe a few stitches. Urgent care is good for that. Minor burns, twisted ankles, knees, feet, finger sprains, nosebleeds, and even most neck and back pain can be managed at urgent care. So I like to say, as far as extremities go, it's really the more distal extremities, right? Unless if it's relatively minor. And then when we start to think about the more proximal extremities, things like shoulders and hips, right? That's when things, tend to get a little bit more complicated. But, so again, minor injuries, bleeding, extremities, lacerations, urgent care is great for that kind of stuff. Next slide, please. Illnesses, upper respiratory infections, right? So where are we? We're at mid to late November now. We are just starting to see New York State is reporting weekly the influenza, COVID, and RSV report. And week over week, we saw, I believe it was about a 70 or 80% increase in flu cases in the last 2 weeks. So flu is on the rise. COVID has remained stable, and RSV is also coming up now. So we're getting into respiratory virus season. The vast majority of people who are otherwise pretty healthy can definitely have their upper respiratory infection symptoms managed at urgent care. The emergency department, I could tell you, we were crazy busy during the COVID years, and also during flu season, we tend to get inundated. But generally, that tends to be people who are sicker, maybe people who have baseline lung disease, baseline heart disease, and they're concerned about getting worse. And those are the kind of patients that are better for the emergency department. But as far as upper respiratory infections go, and we could talk a little bit more about that, urgent care is fine. Earaches, a simple urinary tract infection, right, like a bladder infection, that really just needs oral antibiotics, and urgent care is perfectly equipped for that. Insect bites, tick bites. I can't believe how many people come to the emergency room for tick bites and insect bites. That really kind of gets into people's heads, and they really think something bad's happening. But it's perfectly fine to go to urgent care if you have a tick on you and you're concerned and you feel like you need, some testing or treatment. Rashes, most rashes, whether they're itchy or not, can be managed at urgent care. We tend not to do a whole lot of treatment for rashes in the emergency department. It's usually a very quick visit. High blood pressure, very, very common, right? Hypertension. If you check your blood pressure at home and you note that it's high, I think it would be okay to go to urgent care unless if you don't have any other symptoms, right? When I start to worry about high blood pressure is when it's associated with some symptoms that are taxing your heart or your kidneys or your brain, the major organs. And then COVID symptoms, I think we've progressed to the day and age now where if people have COVID, they can swab at home, or a lot of times people can swab at the workplace. But if not, urgent care is a fine place to go to check for COVID and even to receive treatment. Next slide, please. All right, so head to toe, we'll start at the head as far as what's appropriate for urgent care or not. So there's 4 major types of headache syndromes, right? So sinus headaches, you can see the distribution here. It's around the forehead and behind the nose and the cheeks. There are cluster headaches, which typically tend to be behind one eye. Tension headaches, which are usually described as a tight band, usually around the forehead and the temples. And then migraines. most migraines tend to be on one side of the head, associated with light sensitivity, nausea, and often vomiting. Most headaches can be treated conservatively. A lot of people come to the ER with headaches and they're concerned that they have a ruptured brain aneurysm. That is a very rare thing, and usually accompanied by some other findings, neurologic abnormalities that, a seasoned physician can sort of sort out and say, okay, you might need a CAT scan. But the most headaches, as long as they fit your typical headache pattern, or if um, as long as you're not in distress or having what feels like a stroke to you, you can go to urgent care to get that managed. Next slide, please. So the vast majority of headaches have benign causes. Urgent care is appropriate if you have a history of headaches, if you have sinus symptoms, if you otherwise feel normal. But you should probably think about going to the ER if this is a new kind of headache that you've never had before, and it's severe, or if it has a really sudden onset, and there are other symptoms that make you not feel well, like if you're associated with slurred speech or um, uh, difficulty speaking, any sort of facial numbness or drooping or any kind of limb weakness, anything that might be suggestive of a stroke, you should definitely go to the emergency department. And even consider calling 911 in those situations. If God forbid something bad happens, like a seizure or stroke-like symptoms. Time is brain. If you do suspect a stroke, you really have to get to the ER as soon as possible, because there are certain treatments like clot-busting medications that need to be given within a few hours of your symptoms. Otherwise, they cannot be given. So, those would be reasons to go to the ER for a headache. Next slide, please. So neurologic symptoms. So as I was kind of saying, if you have a history of sciatica, if you have a history of pinched nerves, if you have a history of, spinal stenosis, and you have tingling or nerve pain, that's probably not new to you. You can see your neurologist or your primary care or go to urgent care if you need pain relief. But really any new neurologic deficit, right? If you notice that, you've got a numbness in your left leg that you've never had before, if you have a seizure, anything stroke-like. So we refer to the acronym BFAST to screen for strokes, right? So that's if you're having a new balance problem, eye problems, meaning blurry vision, blacked out vision, part of your visual field goes out, facial drooping, like I said before, weakness in the arm, or a speech problem, any of that stuff that happens in a 24-hour time frame, you have to think about a stroke. All right. And really, if you can't get yourself to the hospital, to call 911. Next slide. So here's the BFAST. We keep signs like this if you work in the hospital. I'm sure you've seen these around. I think they have them in the elevators, right? So B is for balance, E is for eyes, like a blurry vision, F is for face, facial drooping, A is for arm weakness, S is for speech, and then T is for time. If it's new within 24 hours, and to call 911 right away. Next slide. Thank you. All right, behavioral health issues. Mental health problems are recognized more and more. My feeling is that they've always been there, but they've either been masked, or because of our society, they've been sort of downplayed. And so now we're recognizing and normalizing mental health issues way more than we did in a generation ago, which I think is a great thing, because that's going to lead to better treatment for mental health issues and hopefully healthier and happier people. But common things being common, anxiety, insomnia, these are things that are extremely common. Even depression, having a down mood. If you don't have a mental health provider and you're having these kind of symptoms, I definitely urge you to go and see, preferably if you have a primary care provider, that would be appropriate because that's somebody that who knows you and can generally refer you to treatment, typically to therapy. Maybe occasionally they'll put you on an antidepressant. But, and I'm not sure if there's a place. I'm sure there are urgent care providers who will see um, um, uh, mental health concerns. Now, you may or may not be aware. Your run-of-the-mill, CityMD or Go Health is probably not going to be super equipped to deal with this. However, there are behavioral health urgent cares popping up, right? Even at Mather, there's one at Dash where they have unscheduled visits where you can go there for mental health issues. So that would really be appropriate. The ER, Mather, we're very blessed to have our behavioral health unit and great psychiatrists. We have a psychiatric residency. So I feel like I'm surrounded by a lot of psychiatric knowledge and collaboration here. So we do see in our ED patients with suicidal thoughts, patients who are having maybe hallucinations, having delusional disorders, and sometimes these are mixed with substance abuse issues, right? So that they may be what we call dual diagnosis, where somebody has substance use and mental health issues. So anything that is looking like a threat to somebody's immediate health, right? Hallucinations, suicidal thoughts, homicidal thoughts. That's something that really needs to go to the emergency department because there's a fair chance that if it's you or a loved one, you might need psychiatric hospitalization. And again, we don't want to shy away from this. There's nothing to be ashamed of. It's a health issue like any other health issue. And it needs to be dealt with when it gets to a point where it could threaten your health. So any of those things listed, I would recommend that you have a loved one bring you to the hospital. As far as, calling 911, like an immediate emergency, that would be with somebody who's displaying behavior that's imminently suicidal or homicidal, threatening self or others, violent, or if somebody has already made a suicidal gesture, right? Has taken some pills, God forbid, or, done deep cuts on themselves or, carbon monoxide exposure, those kind of things. That is, without a doubt, a 911 call, and I don't think I would need to tell anybody about that. So I'm sure that's pretty self-explanatory. All right, next slide, please. All right, so we're continuing down from brain. Now we're at the eye. So most eye issues are perfectly fine for urgent care. Pink eye, minor eye injuries, like you're mowing the lawn and you feel something go in your eye. That's where you're gonna, get an exam by, a PA or a nurse practitioner. Ours are trained very well to do a good eye exam. We can check intraocular pressure. We can check your visual acuity. We can, and I'm saying this is at urgent care too. They can look for a corneal abrasion, right? So these are sort of the common acute things that cause eye irritation or eye pain. When should you go to the ER for eye issues? If you have a severe trauma to the eye, right, where you have vision loss, or if you are concerned that you might have fractures in the bones around your orbit, right, that's something that you need to go to the ER for. If you have severe eye pain without trauma, that could be something like acute angle closure glaucoma. That's a medical emergency. So that would be severe pain in the eye without any trauma. And then if you lose vision in your eye, right, suddenly, that could be something like a retinal detachment. It could be bleeding behind the eye. So there's lots of things that cause it. So really, if it's like an irritation, redness, or a minor injury, that's fine for urgent care. Any severe injury, any loss of vision, right, get yourself to the ER. Next slide, please. Nosebleeds. Okay, another fairly common thing. Most nosebleeds. The vast majority of nosebleeds can be managed at home, okay, right, without having to go anywhere. If you can just, I'm gonna zoom in here, you're gonna see my schnoz. If you can just pinch right here, okay, so here is right where the bone ends and it gets soft here, and you gotta pinch because most of the bleeding comes from this part of your nose, which is called the septum, right, on the inside. So you gotta pinch that septum closed, and if you hold it for 15 to 20 minutes, you will get most bleeding to stop. The problem with nosebleeds is if you are taking an anticoagulant medication, right, or an antiplatelet medication such as full dose aspirin or Plavix or Coumadin or Xarelto or Eliquis or Pradaxa, there's a chance the bleeding may not stop even with pressure. So while, if I would say this, if you've gotten the bleeding controlled, okay, meaning that it stopped, maybe it's kind of oozing a little bit, but it's not gushing down, you can go to urgent care and they will probably be able to take care of that. However, if you are on an anticoagulant, like those listed there, Coumadin, Xarelto, Eliquis, Pradaxa, and the bleeding is not stopping, meaning that, it's still coming no matter what you do, you take the pressure off, go to the emergency department. Most emergency physicians are trained in stopping nosebleeds. I have a pretty good track record with it, but there are even cases where I have to call in emergently an ear, nose, and throat specialist to get the bleeding to stop. And sometimes that's the case, especially when people take these anticoagulant medications. So, and then 911, if like you're bleeding excessively to the point where you're fainting, or the bleeding's going down the back of your throat and you're choking and you're having trouble keeping your airway, yeah, you got to call 911. All right. So beware of those anticoagulation medications. Next slide, please. Ear issues, vast majority of ear issues tend to be minor and can be managed at urgent care. So earaches, sinus infections, swimmer's ear, right? So there's two different kinds of ear infections in case you're wondering. There is the middle ear infection. So that's like, say I get a cold, right? I get congested and now my ear starts hurting, right? That's what happens to young children, right? It's where the eardrum gets red and inflamed, right? That's a middle ear infection. And then there's swimmer's ear, which is an external ear infection. That's an infection of the ear canal, right? You can kind of see part of the ear canal right here. That generally comes from irritation to the ear canal from either putting something in there like a Q-tip, which you should never do, or they call it swimmer's ear because people get it from swimming, and the contaminated water gets bacteria into the ear canal, and then it gets infected. Both middle ear infections and the external ear infections are pretty easily treatable. The middle ear infections respond to oral antibiotics, and the swimmer's ear responds to topical drops. Okay. Again, the only reason I would think to go to the ER for ear issues would be if you have a sudden loss of hearing. That can, it's not exactly a stroke, but it is a sort of a vascular problem, and there are specific treatments for that that we can do. We can facilitate from the ER. So really, again, loss of, like with your eye, right? Any loss of function of an organ really should be seen at the hospital, right? Because we're looking to restore function to that organ. All right. Next slide, please. Aha. All right. The mouth. So urgent care is fine for most mouth issues: tooth pain, mouth sores, sore throats, TMJ, right, which is temporomandibular joint pain right here where your skull meets your jaw. If you get lacerations to the lips, that's urgent care. When should you go to the ER? So if you start to have like sudden swelling of your tongue, or your lip, or swelling in the back of your throat, right? That could be an allergic reaction or something called angioedema. And that could be trouble if your tongue swells up or your throat swells up, because it could literally block off your airway. And that would be really bad. So that has to be seen in the emergency room. So lip, tongue swelling. If you get a tooth infection, that's now causing swelling of your face and fever, that can be a pretty bad infection. You might need intravenous antibiotics. You might need to see a maxillofacial surgeon. That's an ER visit. If you can't get in immediately to see the dentist, right? But I wouldn't advise you go to urgent care. And then 911, if you have difficulty speaking or swallowing saliva because you can't swallow because of swelling, that's a problem. Or if there's any kind of uncontrolled bleeding coming from the back of your throat or your mouth, that's a 911 call. Really anything, if there's swelling, if there's bleeding, if there's anything that could potentially obstruct your ability to breathe, that is an emergency, right? Get to the hospital. All right, next slide. Thank you. Upper respiratory infections, we talked about them before a little bit. The majority, and when I say majority, I mean about 98%, are viral in nature and do not require antibiotics. I'm going to say that again. Upper respiratory infections are viral and do not require antibiotics. When is urgent care appropriate? Almost all the time, right? If you need symptomatic relief or if you want to rule out a bacterial infection like strep throat or an ear infection. So again, middle ear infections, right? That's the eardrum irritation. That's bacterial that does respond to antibiotics. Strep throat is a specific kind of sore throat. Now, only 10% of sore throats in adults end up being strep. So 90% are not. They're viral. But it may be worthwhile, if it's a really bad sore throat, go and get that rapid strep test and see if it is strep. Because if it is strep, we treat with antibiotics. If it's not, we just treat with salt gargles, ibuprofen, and time, and they'll get better. Okay, so again, when should you go to the ER? If there's swelling in the back of your throat that causes your voice to change, or you're having difficulty swallowing, any sort of swelling back there that makes you uncomfortable and potentially puts your airway at risk, you got to go to the ER, right? So any kind of throat closing, throat swelling, you got to get over to the ER. But for the vast majority of sinus congestion, postnasal drip, runny noses, cough, upper respiratory, just treat it symptomatically and expect to feel better in about 2 weeks. Next slide, please. Thank you. Neck pain. Most neck pain is usually caused by sleeping in a abnormal position or having your neck in a certain position for a long period of time, causing muscular strain. I would say urgent care is fine for most neck pain. The only time I would be concerned would be if you had a fall injury that's causing neck pain, because that can be from a fracture in your vertebrae, and you will likely need a CAT scan to rule out a cervical spine injury. So I would say neck pain from a fall would be concerning. Neck pain that's associated with tingling or numbness, right? Again, a loss of function in a limb, right, is something that would be concerning. Maybe you have a bulging disc that's pushing on a nerve, and maybe it's severe. Maybe it needs surgery. It's unusual, but it does happen. So again, trauma or loss of function would be a reason to go to the ER for neck pain. Next slide, please. All right, chest pain. I sure hope you're not going to urgent care with chest pain, but people do that. And I'm sure it's because of a couple reasons. They probably feel like, well, one, it's convenient, right? They're going to get me seen quickly. And if it's a big deal, they'll let me know. And two, I think most people don't want to believe that something bad could be going on, right? If they're feeling pain in their chest. So, things that can cause chest pain other than a heart attack, right, which is what concerns most of us. Common things are heartburn, right? So that's acid reflux from the stomach coming up into your esophagus. Your esophagus runs right through the middle of your chest, right? Pericarditis. Pericarditis is an inflammation of the sac around the heart, right? That usually happens from a viral infection. Can cause irritation of the pericardium. Mitral valve prolapse. So this is the mitral valve. It's one of the valves in the left side of the heart. Sometimes if it prolapses, it can cause like a very temporary chest discomfort. But the main things that we worry about are what we call angina, right? The worrisome things would be a blockage in a coronary artery that's causing a heart attack. But other things that can cause, chest pain, lung problems, right? Like pneumonia, what we call pleurisy, which is an inflammation of the lining of the lung, and that can be another viral thing, can cause chest pain. And believe it or not, stomach issues can cause chest pain. Your stomach is right under your diaphragm, and your diaphragm comes up to the nipple line. Okay, so if you look at yourself and you see how high up your nipple line is, right, and you go just under that, you could feel ribs, right? Well, your stomach's there, right, because your diaphragm is right there. So you may be feeling discomfort here that's coming from your stomach, just so that you're aware. All right, next slide, please. So when is urgent care appropriate for chest pain? Well, if you know it's from trauma, meaning like, I fell and I think I may have cracked a rib, sure, you can go to urgent care and, they can do an x-ray as long as you're otherwise feeling well and it's not that severe. Or if it's bad acid reflux, you feel like you need a prescription for it, and you've had it before and you know what acid reflux is, that's fine, okay? Or if it's like pain in your chest related to a cough that you have. In most cases, pain from a cough is going to be like a bronchitis, and that's pretty benign. But if this is any kind of new chest pain that you've never had before, if the chest pain happens while you're exerting yourself, if the chest pain is associated with difficulty breathing or dizziness or nausea or sweats, or if the pain radiates to your arm or your jaw or your back, that's concerning, right? So any kind of new pain, any pain associated with other symptoms that are weird, any pain that comes on with exertion, that you have to be concerned about. And then another thing would be fainting. If you have chest pain and you faint, goodness me, call 911, right? You got to have that checked out. That's very likely cardiac in nature, okay? All right, next slide, please. So chest pain, I would say, unless it's very minor, you really should go to the ER. Blood pressure. All right. Blood pressure elevation is something we see in the ER all the time. We also see low blood pressure, which is typically much more serious problem. Urgent care is appropriate if, say, you check your blood pressure at the pharmacy, or you go to somebody's house and they have a blood pressure machine, or you have one at home even yourself, and you check your blood pressure and it's elevated, right? But you don't have any symptoms. You don't have a headache. You don't feel dizzy. You otherwise feel fine, right? It's just an elevated blood pressure and you want to get it checked. Well, first, I would advise, if you have a primary care provider, make an appointment with them and go see them. They are the real experts in management of high blood pressure. But if you don't have a primary care provider, you want to get in soon, you can go to urgent care. And here's a little chart here that tells you what is, from green to red, the degrees of elevation of blood pressure. So, blood pressure has two numbers, right? The first number is the higher number. That's called the systolic blood pressure. And the lower number is, the second number is the lower number, and that's called the diastolic blood pressure. Right, so there's always two numbers associated with blood pressure, but we tend to talk more about the systolic blood pressure, right, or the higher number. And we think about systolic hypertension in terms of, elevated starting at 120. We call it stage 1 high blood pressure if you're between 130 and 140. And then if you're over 140, we call it stage 2. And then if you're over 180, that's when we talk about a hypertensive crisis. Okay. So what do we do if you have a hypertensive crisis? Well, we know that a hypertensive crisis, as long as there's no symptoms of, say, a stroke or a heart attack or heart failure, it needs to be dealt with urgently, but not emergently, right? So if your blood pressure is high, say greater than 180, so say, you take your blood pressure and it comes back 187, right? I would be worried, right? The first thing I would say is don't check it again, right? Or if you do check it again just to see if it was a mistake, you could try it on the other arm, right, to see if it matches. Because the problem with rechecking blood pressure if it's high is that you tend to get anxious and then it just tends to keep going up. So you have to be careful and not take your pressure too many times. So if your pressure is high, and you don't have any symptoms, you can go to urgent care if you want to get seen, and maybe they'll start you on some blood pressure medicine, or if you're already on blood pressure medicine, maybe they can increase it or they can add another one. Some people have to be on 4 blood pressure medications to get their blood pressure under control. So that is a fact. The average person with high blood pressure needs between 2 and 3 medicines to keep their blood pressure under control. When to go to the ER. So if you're seeing your systolic pressure greater than 200, or if you have symptoms, right, that would be a reason to go to the emergency room. Symptoms being your blood pressure is elevated and you also have chest pain, or you can't breathe, or you have a severe headache. Anything that's really concerning, causing symptomatic problems, that's when you have to call. You have to get to the ER. And then what we would do is typically recheck your blood pressure. We would probably give you something to slowly bring down your blood pressure. We never want to drop your blood pressure quickly because that can actually make things much worse. You can get dizzy, you can pass out. So we want to slowly lower your blood pressure and get it to we usually say somewhere between 15 and 30% reduction over about an hour to 2 hours. And that is our goal. And most people end up going home, maybe with a new medication and a follow-up with a primary care doctor or a cardiologist. All right. And then 911 would be if you really are having severe trouble breathing or stroke-like symptoms, right? So those would be symptoms of heart failure or a brain stroke with that high blood pressure. That's when we would say call 911, get to the hospital right away. All right. Next slide, please. Thank you. All right. So this young man's pointing to his back. Next slide. So back pain, it's one of the most common reasons for healthcare visits, right? So incredibly common. I think they say 2/3 of people will have some sort of significant back pain episode at some point in their life. Most of them are due to muscular strain. Urgent care is appropriate if it's not relieved with your home remedies, right? If you're doing warm compresses, you're taking Tylenol or ibuprofen, or if it radiates down your leg, that would be a reason to go to urgent care and get checked out. To the ER, I would say if you have back pain associated with, say, it shoots down your leg and now you can't move your foot, right? So again, any kind of loss of function of a body part, right? We talked about the eye, the ear, right? An extremity. If you can't move your foot, your toes, your foot, because they just went weak and you have back pain, that could be a disc pushing on your spinal cord, and that might need surgery. If you have back pain associated with a fever, that could be a whole host of things. That could be pneumonia. That could be a kidney infection. That could be lots of different things. I would definitely recommend fever with back pain, going to get checked out at the ER. And then as far as when would you call 911, if you have back pain that's where you can't get out of bed, or with severe weakness in one limb, and you can't really walk, you're going to need to call an ambulance because you're not going to be able to drive, right? Or even most likely get to the hospital unless you get picked up. Next slide, please. All right, now we've moved to the upper extremity. I apologize if this is a little graphic, but what you're looking at here is the dorsum of somebody's hand, and this is a flap laceration with some exposed tendon. Upper extremity injuries, a lot, I would say, again, we think more about function, right? So if your limb still has normal function, you're able to move, you're not limited, and you don't see tendon or bone sticking out, I think you can go to urgent care. If you see tendon like this, you may need a specialist because there might be damage to the tendon, and so you'd have to come to the ER because we have a hand surgeon who's on call, and if you happen to nick one of your tendons, it would most likely be a hand surgeon who's fixing that to restore your function. So again, loss of function, right? A deformity, If you have a laceration that shows tendon or bone, that's a visit to the ER. Call 911 if you have a digit amputation, right, or a degloving. Say you're working with a power tool and part of a finger comes off. You probably shouldn't be driving to the hospital in that situation, right? If you don't have anybody to get you, you want to try to find that that amputated tip and get to the hospital as soon as possible. Degloving means that the skin has completely come off of an extremity. That again is going to require a hand surgeon that's not appropriate for urgent care. Or if you see a fracture of a bone in the hand or the wrist where the bone comes through the skin, that's going to need an orthopedist. That's going to need probably go to the operating room and have a surgical washout. So loss of function, right? Visible tendon, visible bone, right? Those would be reasons to come to the hospital. Next slide, please. All right, now we're going to talk a little bit about abdominal pain, something that people frequently go to the urgent care for, and I generally advise against that, but here we go. So this is just as we talked about here, right? Here's the nipple line, and look at that. Here's your liver just under the diaphragm, and here's your stomach, again, just under the diaphragm, right? So problems here can manifest as chest pain. So we've got the liver, here's your stomach, here's your small intestines, here's your large intestine, otherwise known as your colon, right? And then we've got the gallbladder, which is hiding right here under the liver, and your appendix is down here in the right lower abdomen, right where your colon starts. Next slide, please. Thank you. So for GI symptoms, if you know that you have, say, IBS or gastritis, right, or you get like upset stomach, or you get constipated, things that kind of fit a normal pattern for you and you just need some symptom relief, that's fine, right? If you know what it is, if you've had it before, I think urgent care is appropriate. But if you have any kind of new abdominal pain that you don't recognize, a pain that you've never had before, and it doesn't go away, or if it's associated with fever or vomiting, or if you see blood when you vomit or when you stool, those are reasons to go to the hospital, right? We always have to be concerned about bleeding ulcers. They can cause a lot of blood loss, right? You might need a blood transfusion. And then all those organs I just showed you, right? The gallbladder can get inflamed, that's cholecystitis. The appendix can get inflamed, that's appendicitis. The colon can get inflamed, that's diverticulitis, right? All these things that might need antibiotics, they might need surgery, right? You need to know. You're probably going to need to have a CAT scan or an ultrasound, and you may need to see a surgeon, right? So, and then as far as when to call 911, if you have a sudden onset of the pain, if there's fainting, right? Anything where you're concerned about loss of consciousness, that kind of thing, that would be a call for 911. Okay. Next slide, please. All right. Genitourinary symptoms, right? So what we call the GU tract. So when is it appropriate to go to the urgent care for genitourinary problems? So like I said before, a simple bladder infection, right? If you feel like you're having burning going to urinate, or you're going very frequently, that's pretty easy, right? You just need to give a urine specimen sample. They can make the diagnosis and they can start you on an antibiotic. Vaginal yeast infections, they usually respond very well to antifungal medication. That's perfectly appropriate at urgent care. But for a lot of GU symptoms, I would say the ED is more appropriate. So if you're seeing blood in your urine, especially if you take blood thinners, right, that could be concerning for an infection, for a stone, or for even a malignancy. If you have urinary tract infection symptoms, but you also have a high fever or pain in your kidney area, that should be a visit to the ER, because you may need intravenous antibiotics, right? So most urinary tract infections start out as a bladder infection, and then sometimes they can go up and go to your kidney. And kidney infections are a different beast altogether. Kidney infections tend to be much more severe. They cause high fever. We generally will hospitalize somebody at least for like 24 hours to give them intravenous antibiotics for a kidney infection to make sure that it's under control. Any kind of new severe testicular pain or scrotal pain that needs an evaluation in the ER, we typically will do a sonogram to make sure you don't have like a twisted testicle. Same thing for vaginal bleeding or pelvic pain. Pelvic pain can be a twisted ovary, right? It could be an ectopic pregnancy that usually requires a pelvic sonogram and also, sometimes consultation with a gynecologist emergently. If you have a suspected sexually transmitted infection, if you're not very symptomatic, you can probably manage that at urgent care. But in the ER, we have the ability to do the whole panel of STD testing, or what we call STI now, sexually transmitted infection testing. So I would recommend the ER in those cases. If you suspect you might have a kidney stone, right? Kidney stone pain is usually pretty characteristic. It's a very sharp pain. It's located in the side, like right over here, and sometimes it radiates down to the groin area. That is not something that I would recommend going to urgent care for, because you're likely going to need imaging with a CAT scan and pain control with an IV. So flank pain that you think might be a kidney stone, you should go to the ER. There's a condition called priapism, where a penile erection lasts more than 4 to 6 hours. That is a dangerous condition, usually associated with sickle cell anemia, but sometimes associated with some medications. And that would be, that's going to require an emergent urology consultation. And same thing for a fractured penis, which can happen sometimes during intercourse. And that needs surgical correction. 911 should be called if there is any, if there is a sexual assault or rape, or if there's any kind of high fever associated with genitourinary conditions, confusion, weakness, fainting, anything where you might have like sepsis, right, from an infection. You should get to the hospital right away. Next slide, please. Lower extremity injuries. So you can see here, you get the swollen knee, right? Fairly common. So most ankle and foot injuries, knee injuries, even if you're able to walk on your knee, are fine for urgent care. Lacerations that, again, that don't show tendon or bone. So again, function, right? If you're able to walk, if you're able to bear weight, right, and you just have, you're concerned about a possible fracture or a sprain, they can get x-rays at urgent care and they can splint you and they can take care of that. But if it's a hip injury or a pelvis injury, or or a knee injury with difficulty walking, really any inability to walk, again, right, loss of function of the limb or the organ, you got to go to the ER. All right. And then when to call 911. If you injure your hip and you can't stand up to bear weight, that's a 911 call, right? Because you probably have a hip fracture, you're going to be in a lot of pain, and it needs to be immobilized carefully. So that's an EMS call. And then, of course, things like uncontrolled bleeding, same thing like upper extremities, loss of a digit, degloving injuries, fracture with bone coming through the skin, tendon or bone visible, that kind of stuff. That's a 911 call to the ER. All right, next slide, please. Swollen and painful joints. So if you have a typical pattern, right, of osteoarthritis, rheumatoid arthritis, and you're otherwise feeling okay, most swollen joints can be seen by your primary care or urgent care. But if you have a fever associated with a swollen joint, again, if you can't bear weight or move it at all, right, or if you've recently had surgery on that joint, right, or you have a compromised immune system, you have to go to the hospital, right? Because then we're looking at something like what we call a septic joint, right? Could there be an infection inside the joint? And then the only way to know that is to get fluid out of the joint and analyze it in the lab. And they're not doing that at urgent care, okay? So, and then 911, if there's, again, high fever, confusion, concerns for sepsis, right? Like severe infections would be a reason for to go to the ER for a swollen or painful joint. But that being said, a lot of painful joints, most knee swelling that happens tends to be just osteoarthritis flaring up, sometimes gout. These are common things. And unless there's a fever, or unless you're not able to bear weight, you can probably get checked out by your doctor or by urgent care. Next slide, please. Rashes. The vast majority of rashes are benign and can be seen in urgent care. Things like poison ivy, eczema, they're all pretty common. As far as visiting the ER, if you've developed hives and you don't have a history of hives or allergies and you're not sure what's going on, especially if you have facial swelling or wheezing, that could be a severe allergic reaction, and I would recommend going to the ER. If you have a rash that looks like an infection, right, like what we call cellulitis, if it's minor, you can go to urgent care and they can put you on antibiotics. Also, if you have a suspected abscess, if you feel like there's a boil, if you don't know what a boil is, it's like a what we call fluctuant. It's like a bouncy area just under the skin that's very tender, red, painful. That oftentimes needs to be cut open and drained because usually, basically, it's a pus pocket. They can do that at urgent care, but I think we do a better job at that in the emergency department. And then if you have cancer or low platelets, sometimes rashes can be associated with low platelets, and you may need a platelet transfusion, right? So, and that's a specific rash called a petechial rash. So you would know that if this has ever happened to you. Again, when to call 911 if the rash is also associated with swelling of the lips or throat, right? Or if it's so severe that it looks like a major burn. And there are some rashes, like certain strep bacteria, staph bacteria can cause these like scalded skin syndromes where it almost looks like a burn. That might be a reason to get to the hospital quickly. Next slide, please. So here's an example of cellulitis on the left, right? So that lower leg has a red rash. You can see it's pretty well-defined border. I'm sure if you touched it, it would feel warm, and it might be tender to the patient. And that is cellulitis, and that is treated with antibiotics. If I saw a patient with a cellulitis like that, of that degree, I would probably offer intravenous antibiotics and an overnight stay. And then we would keep the patient on intravenous antibiotics until that we knew the infection was under control. And then once we see that it's getting better, we would send the patient home with oral antibiotics. And on the right, that's that petechial rash that I was talking about that's associated with low platelets. And if you push on these, they stay red. They don't turn white. Most rashes, right? If you push on the red rash, it turns white. That's called blanching, and that doesn't happen with these. So that would be concerning for like a low platelet condition. Next slide, please. Insect bites, we talked about this. Don't need to go to the ER. An embedded tick or a suspected tick bite with a rash, that can definitely be managed at urgent care. A word about Lyme disease: if you pull a tick off your skin, right? Okay, I'll give you a couple points about Lyme disease. If you pull off a tick and it's not engorged, okay, meaning it's not all big and swollen with your blood, there's almost a 0% chance that you're going to get Lyme disease because a tick has to have a blood meal in order to transmit Lyme disease, okay? So don't worry. If you find a tick on you and it is engorged and you don't know how long it was on you, and presumably it could have been more than 24 to 36 hours, there is a chance that the tick could have transmitted Lyme disease to you. In that case, I would probably recommend going to urgent care. They don't need to examine the tick. They're not going to send the tick off for testing, right? But they may say, okay, I'll give you a prophylactic dose of an antibiotic. Prophylactic means preventative, to prevent Lyme disease. And it's been shown that one dose of doxycycline after a tick bite has a significant effect on preventing Lyme disease from happening. Now, do we test people, or should we test people for Lyme disease if they come in with a tick? The answer is no. And the reason is this: if you get bitten by a tick and they transmit Lyme disease to you, it's going to take 2 weeks for those antibodies to develop, okay? And the antibody test is what we are checking when we're checking for Lyme disease. So even if you got bit today, your Lyme disease test would not come up positive for at least 2 weeks. So if you get the test tomorrow, it's going to be negative, right? Guaranteed. So it would be a waste of time. So a word about Lyme disease testing. Please don't insist to your practitioner that you want Lyme disease testing the day of your tick bite, because it's going to be negative. All right. When to go to the ER? Allergic reactions to a bee sting. Again, throat swelling, wheezing, anything that can include the airway. All right, next slide, please. So here is the Lyme rash. It's called erythema migrans rash, right? So these are the different ways it can look like. This is the classic bullseye, right, where it's sort of red in the center, then you have a clearing, and then red at the edge. But that's not, mostly, it's typically like a red patchy rash like this. The ones that I've seen, you don't typically see the bullseye, but it could be bluish red. You could have a blister in the center, and then sometimes you may have more than one patch, right? So these are the many ways that the Lyme disease rash can look. Next slide, please. We're getting up on time, but we're almost done. Burns, right? So they come in 4 degrees: first, second, third, and fourth degrees. First and second degrees, so first degree burn would be like a sunburn or a minor burn, a minor scald. A second degree burn, the classic one, would be a scald, with hot water or hot liquid that causes blisters, right? A third degree burn penetrates the entire epidermis down to the dermis, and fourth degree burn goes through the dermis to the lower tissues. So, most of these can be managed at home. I would say you go to the ER if it's associated with smoke inhalation, right, from a fire. You have to get checked out. Burns that involve the face, the hands, the feet, the genitals, especially anything that could be cause singeing of your nostrils or inhalation of your throat with irritation. Those are reasons to go and get checked out. So really smoke inhalation is the big one there. Or if it's a severe burn with an immediate threat to your extremity, you got to get checked. So face, right, hands, they'll have to get checked out. Next slide, please. All right, so COVID, our last couple slides. I think we're all very familiar with COVID now. When to go to the ER? If you have a pulse oximeter at home and it reads less than 92 consistently, or if you're unable to keep fluids down and you need IV hydration, right? Those would be the need to go to the hospital, because you might need oxygen and you might need an IV, right? Next slide. We don't use monoclonal antibodies anymore for COVID, and we still use remdesivir for patients who are hospitalized who are high risk of complications from COVID. And we still use steroids also for patients who require high amounts of oxygen in the hospital. Next slide. But we now have oral, right, medications. I'm sure you've seen the commercials, right? There are 2 major pills that you can take now that reduce death and hospitalization in COVID, right? There's Paxlovid, and then there's also molnupiravir. Ivermectin, in case you are, still living back in 2020, has never been approved by anybody for the treatment or prevention of COVID. And people who have taken it to treat COVID have had problems with toxicity, and it's definitely not recommended. Next slide. All right, so that is it. I am right on time. It is 1 o'clock. But if you have any questions, I'm happy to stay past and answer them. And thank you for your attention and for listening. I appreciate it.
Yes, thank you, Dr. Wass. And just to repeat what he said, if anybody has any questions, you can enter them at the Q&A feature at the bottom of the screen. I'll give it a few moments here. All right, it looks like we don't have any questions. But if anything does come up later in the day, you can email them off to matherhospital@northwell.edu. Once you exit the webinar, you're going to see a brief survey. If you can complete that for us, that'd be very much appreciated. It helps us plan future webinars and events. But I wanted to thank you again, Dr. Wass, for your time. Thank you, everybody, for joining, and enjoy the rest of your day.
All right. Thanks, Jonathan. Take care.